So many thanks, Raina, Claudia, Kate and Ali. Fantastic presentations. So now we're going to move on to perspectives from two of our national funding bodies and international perspectives from the United Kingdom and the United States. So we're going to start with Professor Sue Gordon. Sue's an esteemed researcher and research leader in ageing and research translation. She heads up ARIIA, the Aged Care Research and Industry Innovation Australia Group, which is funded by the Commonwealth. And the objective there is to increase the aged care workforce capability and the capacity to adopt and embed evidence-based practice across the sector. So I'll now pass over to Sue to talk about how they're enabling knowledge translation in the aged care workforce. Thank you, Sue.
Great, thank you very much for that introduction, Judy, and thank you very much for the opportunity to speak today. I'm the one that had the technology issues, so Georgie's very kindly going to help me navigate these slides today. Georgie, perhaps if we go on to the next slide. I'd like to just start by acknowledging that I come to you from the lands of the Kaurna people, the Adelaide Plains, and pay my respects to the elders past, present and emerging, and extend that acknowledgement to the peoples of the lands from which you're joining us today. Thanks, Georgie. In the presentation today, I'm going to take just a little bit of time to talk about ARIIA's role in enabling knowledge translation in aged care. It's always interesting that some people don't actually know very much about what we do still. And then what I'd like to do is share with you what we've learned over the last couple of years while we have been using our programs to enable that knowledge translation. And I'm actually going to be drawing from our in-house program, and I'll tell you a bit about that as we go through. Thanks, Georgie. So ARIIA was funded by the federal government to increase the capability of the aged care workforce to actually translate research into practice. And it was also considered that with the changing dynamic in the aged care sector, that there was also needed to be growth, that improved models of care, particularly enabled by technology, so growth in technology as well. And the government particularly wanted the work that we did to address the grassroots ideas. So what is it that the aged care workforce are telling us needs to be done? Responding directly to the needs of industry. Thanks, Georgie. Now, we had a period of consultation, about 6 months, before the model for ARIIA was actually proposed to government. And during that time, we heard that one of the biggest impediments to translating research into practice in aged care was that people didn't have access to the research findings. And so we have a knowledge and implementation hub, and I'll talk more to each of these work streams in the next few slides. But we all know that knowing what to do or what you might want to do is one thing, but actually knowing how to actually implement it on an everyday basis is the challenge. And we've heard that from our speakers previously today. We also, in terms of bringing together the right people to really have growth through technology and adoption of technology as part of the translation of research into practice, was something that really needed some help, and so the Aged Care Partnering Program is another stream of work. It's been lovely to hear our grants recognised by a couple of our speakers today, and I'll talk a little bit about those. What ARIIA does have a very important role is around advocacy and policy, that we are able and we are working with the Department of Health and Aged Care on an almost weekly basis around what are the things that we're seeing, what are the things that are working, and what are our grants actually showing. Thanks, Georgie. When we did that sector consultation over those 6 months, we also shaped up priorities. And so our grants, our resources have been in response to the priorities that the sector has actually identified and reported. And we have cross-cutting themes, and I think if you look at these down the right-hand side of the slide, you'll see that they very much respond to many of the things that our speakers have already talked about today, and that are so important for implementation of knowledge into practice. Thanks, Georgie. So just running through our work group. So many of you know Professor Jen Tiemann from Care Search, Palliaged, REPAD. So Jen leads our Knowledge and Implementation Hub. And what we have done in this hub is to bring together the grey literature and the academic literature. We've put it into language that is far easier to understand. And we have a searchable database there where you can actually use our search engines to find what you're looking for at any point in time. So it saves putting all of those search terms together. They're already there. So it's free to use by anybody. If we can just go on to the next slide. Free to use, anyone can come in and access it, members of the public, people in the aged care workforce. And what you'll find there are these sorts of resources, PDFs that basically summarise what is best evidence at the moment. And of course, we're continually updating these. So please use these resources. They're freely available for everybody. Next slide, please. And as I said, it's not just about knowing what to do, but it's actually understanding how to do it. And so at ARIIA, we have the Innovator Training Program, which we've delivered to nearly 600 people working in aged care over the last 18 months, 2 years. And as I said, this presentation is, in the second half, going to be all about what we've identified during those particularly in-house programs. This program is designed that someone, an organisation or an individual within an organisation comes to us with a problem. And what we help them to do is unwrap that problem, to understand what is the core, and then to look for what the evidence says. What's your best bet? What's the best evidence for how you might find a solution for that problem? Recognising that it's rare that you can pick something up and just pop it in, that you do have to contextualise it. And so we work through that contextualisation of an evidence-based solution to the particular organisational setting with which we're working. Now, implementation science principles then are used, project management principles, change management principles, to put together an implementation plan for how you are actually going to put that evidence into practice. And of course, evaluation, so important. So people leave the program with a project plan and they leave with a pitch, because you do have to sell what you are doing within your organisation. Thanks, Georgie. So I said we have different variations on the Innovator Training Program. When we first proposed ARIIA, we thought that scheduled programs that were for 1 or 2 people from an organisation would be the way to go. But what we found was that organisations particularly were looking for what we've called in-house programs. Sorry about that. In-house programs. And this is where we actually go and work face-to-face with an organisation with up to 20 people in that organisation to find the best method to implement change within their environment. Thanks, Georgie. We also, as I said, have the Aged Care Partnering Program led by Professor Jill Harvey, who many of you know, who is an expert in knowledge translation, and Professor Karen Reynolds, who is Head of Engineering and is an esteemed engineer in Australia. And this group are about bringing technology and aged care together and looking for what the problems are to be solved, and then that collaboration of the right people to solve those problems using technology. We have on our website a number of opportunities around this. So if you're interested, please take a look. Thanks, Georgie. So, and as you've heard, we've got 60 funded translational research projects underway, all at varying stages of progress. Final reports are starting to come in, and as they do, the outcomes will be posted on our website. So again, keep an eye on that. Thanks, Georgie. So coming to what have we learned, and listening to everybody, much of this has actually been, I think, covered off. But I think perhaps what we see as some more nuanced things as we're dealing with different organisations. And as I said, this is based on what we have seen when we actually go into working with organisations in our in-house program. Now, we all know that organisational priorities are shaped by internal and external forces. And I think it's very easy to identify the external forces that have been at play in aged care, particularly over the last 3 or 4 years. We've had COVID. We have a reform agenda that's based on the recommendations of the Aged Care Royal Commission. We've had new standards. We've had quality staff ratings introduced as well. And these have reshaped and prioritised the translation of knowledge into practice in recent years. And when you do have regulatory and compliance requirements, this does actually limit the opportunity to translate research that is more innovative. I think it's caused us perhaps to be a little more focused on, on this whole agenda, which organisations have to respond to. So savvy organisations have aligned their innovations with those current priorities, and sometimes with funding opportunities as well. And I think one of them that we're seeing a lot of is the implementation of small home models or homemaker roles for aged care staff and person-centred care approaches, but actually being able to align it in an environment where there are scant resources is a really important strategy for organisations. Thanks, Georgie. We know that the sector does believe evidence is important, and that translating evidence to practice to address a problem does provide confidence that in fact the solution might work. And when you have scant resources, it's really important to have something that you think is going to work. So the organisational priorities and strategies are often determined at a board or a senior management level. And so we have to be thinking about the risk of putting resources into something. And so having something like, or somewhere like the Knowledge and Implementation Hub, where you can actually find the research findings in accessible language so that you can understand them and then make a decision. And as I said, unusual that you can just adopt something, more like that you'll need to adapt it or go through a process of contextualising that evidence for what it is that is most likely to work in your setting for your people. I think sometimes with evidence, aged care hasn't always been very good at understanding its in-house data. You'll all know that there's a massive amount of reporting of data, but what are we actually doing with that data in terms of understanding it and recognising that this in-house data, so reports of falls, reports of wounds, is contemporaneous, it's right now, it's what's happening on the ground. And it's contextualised for your setting, and actually using that data as evidence about what you need to address, but also what you need to change, not just address with evidence, is really important. And I think the recently released Aged Care Data and Digital Strategy supports that very highly. Thanks, Georgie. So pre-implementation, this is an interesting one, because when we've been looking at what's been going on when we're doing these programs, the pre-implementation is just so important, and everybody really wants to jump to the doing. So contrary to rushing in and really kind of putting out fires and then moving on to the next problem, the people that we're working with have actually spoken quite a lot about the novelty of just being given permission to have the time and the space to think and plan rather than rush in. And I think this is something that's so important in actually setting up an implementation project to go well. Our participants often identify that in the past, what's gone wrong is the rushing in, and that it does lead to poor outcomes. So the change management process that's needed is essential if you're going to be successful. We do a pre-mortem, and a pre-mortem, many of you may have heard of it, but it gives you the opportunity at the beginning to go, well, what's going to go wrong here? And what can we do to mitigate that so that you build in things to mitigate the risk of something not succeeding? And really important, somebody said something about this in another session, consider the change in the context of the workflow. Consider the change in the context of the consumer before you even start, because if they don't fit, you're not going to have a terrific outcome. Thanks, Georgie. So inclusive code, because we talk a lot about co-design. I don't know that we always do it terribly well. Sometimes I think it's still more like consultation than co-design, but it can't stop at co-design. It has to be co-production and it has to be co-evaluation, because people need to be on the journey for the full journey, not just on the journey for the start. And the comment, an IT project is not all about IT, speaks to that, and that you do need to have the right people in the room across all levels of the organisation. You do need to have residents and families involved in the unwrapping of the problem, in the development of the solution and the delivery of the solution. So I think, this is really important. And we've seen genuine surprise for some participants that they are actually being consulted. And the people on the ground are the ones who often know what the solutions really need to be. So that opportunity for the richness that comes from your own people who are on the ground and their families and those receiving services shouldn't be overlooked. Thanks, Georgie. Having an open mind, I think this is a really interesting one. So genuinely engaging with the evidence rather than actually jumping into a solution that probably is going to be aligned to your expertise, your professional lens, your scope of influence, and in some cases is likely to be quite biased. And so really engaging and looking at that evidence in a curious way, because you don't know what you don't know. And the evidence is sometimes surprising. It's not what you expect. And there's an old saying that if you've got a hammer, every problem is a nail. And so we need to actually be a little bit more open to things. The other thing I would say is around compliance meeting innovation, and that reforms such as the standards do provide a framework that ensures safe, person-centred care, but it does allow organisations to meet those standards and implement changes to meet those standards in ways that are actually specific to the people that you're providing care for. And it can be innovative as long as it remains safe, effective, and person-centred. So thinking outside of the square while still meeting your compliance requirements, I think is a really important aspect to implementation at the moment. Thanks, Georgie. Implementation skills is a really interesting one. They're really, really important. And having an investment in your people so that they have the skills and knowledge around implementation, project management, change management, so important to get it right, is really important. And understanding also that implementation is not business as usual. And again, a previous speaker did include this, that it doesn't just happen. All of the staff are already busy. They're busy with their operational work. So we shouldn't underestimate the essential need for skills. We shouldn't underestimate the amount of time, and we shouldn't expect that it's just going to happen through osmosis, because it doesn't. Thanks, Georgie. And this brings me to the team. The buck must stop somewhere, but change actually needs everyone's effort. So everybody needs to be on this road of implementing research evidence into practice. You do need a leader, and it's identifying the best person to lead. And that may not be the person who has the more senior position. And you need champions to support that leader across the whole organisation, so a network of support, and that actually can go beyond the work group to families and residents. One of the things that I've seen over the years is that people have become institutionalised, our workforce has become institutionalised, and they actually need permission to change what they do. And this is an important part of allowing them to work differently. Thanks, Georgie. One more to go. And this speaks to the, two more to go. Starting small. Small changes breed success and then start embedding them. And last slide is embedding in every day. And this is about seamless change, making work easier, making it effective and efficient. You need policy and process to back it up. And culture does eat strategy for breakfast. So let's get some really good change management foundations, and habits eat innovation for breakfast. It needs to be iterative. It doesn't stop with one cycle, and you need to be on the merry-go-round of continuous quality improvement. Thanks all very much.
Thank you so much, Sue. That was just awesome, that talk, and I think it just speaks to everything that we're all living every day. Brilliant.